You don't hear anything?
I don't hear anything on mine.
Is this she supposed to hear?
And neither one of them.
I can hear.
Lord, hold on. Like, girl, you know, we at your cousin's basement. Like, hold on.
Thank you.
You want, wait, look.
Thank you. Oh, yeah.
Oh, now you hear?
Now it's like, I hear.
Anita in full bloom?
Okay, here we go. "24 after the hour, right here on the Talk of Chicago, 1690 AM, WVON. You're listening to Real Talk, Real People. I'm your host, Chat Daddy. It's the Monday night edition of your favorite entertainment magazine show here at VON, where we talk about just a little bit of this and a whole lot of that. It is Medical Health Awareness tonight, and so our entire show this evening is dedicated to the overall well-being of your tip-top health. Even though we're expecting this polar vortex,
Yes.
we want a lot of you all to stay healthy. Maybe the doctors can give us some tips tonight. We're going to open up the phone lines. Any questions you guys may have, we're here to answer them for you. January is National Thyroid Awareness Month, and our wonderful doctors from Quench Wellness are here with us this evening. Dr. C and Dr. G, you know, we have to make it all trendy around here when people stop by to see us. And they're here tonight to talk about thyroid awareness. But ladies, we also probably need to cover what people need to do in the cold weather as well, too. Ladies and gentlemen, please put your hands together and welcome back to Real Talk, Real People from Quench Wellness, located in the South Loop area of the city. Two phenomenal doctors from our area, Dr. C and Dr. G. What up, Dr. C and Dr. G?
Hey.
Hey, ladies, how are you?
We're doing great. Thank you for having us.
Yes.
If you're not doctors, you could be a female singing group, because you did that in harmony. You was like, hey. Ladies, introduce yourselves. Tell us, because you both have just incredible names. You know what I'm saying? You have names with hyphens, commas, semicolons, all of that good stuff. So go right ahead, doctors.
I'm Dr. Chantal Stevens Archer. I'm a co-medical director for Quench Wellness. I'm also a board certified internal medicine doctor, currently functioning as a hospitalist.
And I am Dr. Gamali Dekai, and I practice emergency medicine by trade, and also co-medical director at Quench Wellness.
Very good. Both beautiful ladies. So glad to have you back here in studio with us. So now,
Thank you.
ladies, oh, my pleasure. January is Thyroid Awareness Month. Now, we also, you know, people always, oh, my grandmama had issues, or my father, or aunt, or what. But what is the thyroid? First of all, let's clear up what it is and where it's located. Because I've seen people point to their big toe, talking about a thyroid. And use a lot. That ain't your thyroid, that's gout. That is not your thyroid. But it all might be related. I don't know. So
For
can you help us
sure.
out? Yes.
You know, the thyroid gland is a little small gland about the shape of a butterfly, and it sits right in the middle of your neck. And although it's a small gland, it has tons of functions. You know, it's not easily visible, so people commonly don't think about it, you know. But the thyroid gland helps from everything from the head to the toe. I mean, your hair, your skin, your metabolism, your temperature, your mood is all affected by that. How well you sleep, how you lose your weight, your digestion, everything, even down to your fertility, is all affected by your thyroid. So even though it's a small gland, it's a mighty gland. And that's pretty much what it does.
So now, real quick before I cut you off, now that's not like my Adam's apple though, right? So it's not. So it would be behind that.
Below it.
Below
So
it.
it's nothing visible.
No, you can't. The only time you can see it is when you develop something like nodules or a goiter. And you remember goiters, we don't have them very much, you know, right now. Back in the day, they used to be very common because we had iodine deficient diets.
Okay.
But now, you know, they pack iodine in the salt that we use. You know, you see that all the time. And then a lot of our soil has the iodine. So people don't get goiters very often anymore.
Yeah, I remember the Three Stooges used to always talk about one of them had goiter.
Yeah, I mean, it's a visible enlargement of the neck. There's no way you can miss it.
Okay.
The thyroid gland, which normally sits right about here, gets so large that it takes up almost the entire neck.
Oh, wow. Okay, Dr. G, you were going to say before.
Oh,
I'm sorry. Go ahead.
yes. No, I was just going to mention, Dr. C has said that it's a gland. So for those who don't know, I mean, we have several glands in our body, but a gland is an organ that releases important substances for optimal function in the body. So for example, your pancreas is a gland which releases insulin. So it's one of the glands in the body.
One of the glands in the body. Okay, so now, at what particular age does the thyroid start acting up? Now, I was having a conversation with some people saying that I guess women that are premenopausal might, and then a lot of people are really confused thinking that thyroid only affects women. So let's kind of unravel some of those issues.
Yeah, so obviously, thyroid disorder, that general umbrella is very common. I mean, about 20 million Americans are affected with thyroid disease in some form or capacity, and about 60% of them don't even know they have it, right? And you're absolutely right. It disproportionately affects women. 1 in 8 women will have some form of thyroid disorder, but men can have it too. And what determines whether you have it or not, there's obviously a genetic component to it too. So there's some truth to, hey, my grandmother had it, my mama had it, so I might get it. There's some truth to that. It's commonly autoimmune, meaning your body kind of attacks the gland itself and you develop these disorders. But there's some other factors too, like you mentioned, something I like to call thyroid pause. And that's pretty much when the thyroid gland starts to dissipate in terms of how much hormone it releases. And unfortunately, it kind of follows the same course as menopause and andropause.
Okay.
Yeah, so right around that time when men start to lose their testosterone, women start to lose their hormones, you go through the changes, your thyroid gland also follows suit.
Oh.
And that's an important thing to note because, while you're going through all these hot flashes and mood swings and you're gaining weight and you're going through all those different things, yes, your hormones are probably at play, but don't forget your thyroid gland could also be acting up on you too. And so that's another one you just want to keep an eye on.
And, honestly, the thyroid can dysfunction at all ages.
That's
There's
true.
even neonatal or really little babies can have thyroid issues all the way up to our grandmother and grandfathers can have thyroid issues too. So it really doesn't discriminate. And like Dr. C said, the symptoms can sometimes be so subtle and you may think it might be related to something else. So oftentimes when we're wondering what could be going on with this patient, we've looked at everything. Once we check the thyroid, that usually is the culprit.
Okay, all right. When we come back from break, ladies, I want to talk about maybe some of the signs and symptoms. Because once we tell people someday, I think I got it. I got it. No, if your toe is swollen, that is gout. It is not a thyroid issue. I'm sick of y'all self-diagnosing yourself. That's why we do this show. You're listening to Real Talk, Real People. We'll be back in just a moment.
Did you give those dates for the Twin Doctors?
Oh, I did. I did. Bro, I had such a great time last week in Florida.
Oh, wonderful.
Oh, yeah, I will. I'll schedule all that. Because I start school.
See your statistics.
Okay.
That's what you saw me that day. I start next week.
I was
So
reading
I
Okay.
gotta- I'll get
personality
everything
test
together,
today.
send it all to you and all that. Yes,
Okay.
absolutely.
It's like spot, but mine was too.
I'm kind of surprised though because they asked such little questions.
I mean, it was spot on.
He's still alive?
Yeah. They gonna hear the conversation. Hey y'all, we on the radio. We're on commercial break right now,
Yeah.
so we're chit chatting about our personality test.
We haven't seen each other in a while, so can we be friends? I mean, can we have a moment?
Yeah. But I think what it looks at is not only your choices that you make for your personality test, but I think it looks at your time. It looks at, because they ask the same question in different ways, how meticulous you are in picking it. and all that.
Man,
That's that letter one?
yeah. The
No,
behavioral
this is not the
assessment.
letter one.
It's
Oh.
for ABC.
No, she's talking about like
She
thinker,
was on time.
judger,
Yeah, yeah.
Oh no, not that.
introvert, extrovert.
Yeah, it's crazy.
Hey y'all, we're on
So
commercial
you all
break.
getting ready for this freeze.
This polar vortex
Oh my
is coming.
gosh.
Oh man.
I put the electric blanket on my bed.
You're getting prepared.
I blew a fuse today. I have to remind myself I'm in an older place, so it's like, all right, no, you can't microwave it.
And have
And
the
put the
blanket.
electrical blanket going.
Yes.
I have the electric blanket throw, and then I have a flat screen fireplace thingy.
Oh, he had it all
And
going
then
on.
I got well, I like the ambiance of the fireplace. The heater's okay on it, But then I have one of them little grandma heaters down by the TV. And then that's the living room. When I go to bed, I say, hey Google, turn on the heat in the bedroom. And so, and then when I get out the shower, I turn on the electric blanket and let it preheat the room.
My mother bought us electric blankets one year for Christmas. I was like, who told you I wanted this? I took that thing right to JCPenney's and returned it.
You lying. You couldn't do, you can't get
I'm
see.
so serious. I left
And
it
I only
right there.
let one side of the bed. See, I can't be both. One side of the bed gotta stay cool. Because once I get, I need to be able to
Switch over.
slide over. Right, because baby, once I get it, it'll be like, ooh, Lord, Ziff. Is that person named Ziff? Okay, here we go.
Got a call.
Okay. I'm so tired. Thanks, friend.
You're amazing. Don't let anyone tell you otherwise.
I was showing my sister your mug. She thought it was so funny.
I'm your real friend.
You are. You really are. It's my favorite mug now.
We're about to come on air in a few minutes. Coming off of our commercial break.
I wish
Enjoying
y'all
some
could hear this
jams.
music. So good. It's like a throwback.
Vanessa Williams.
Like Jody Watley or something. Who's
Vanessa
this?
Williams.
Ah.
35 after the hour, right here on the Talk of Chicago, 1690 AM, WVON. You're listening to Real Talk, Real People. I'm your host, Chat Daddy. It is the Monday night edition of your favorite entertainment magazine show here at VON, where we talk about everything. Yes, we do. We're an entertainment show, but we hope that you take away a lot of great information from this show. And you know it is happy hour, right? Yep, it is. So you should have that beverage of choice. That's right. You better get them that beverage of choice. I don't know if they need it on the rocks tonight, though, honey. It's cold. Y'all need to be drinking hot stuff. Hot alcohol, hot soda, right, all that, right.
Body.
Yeah, your belch need to be minor when it's cold. You know what I'm saying? You belching like that and it's cold, something's wrong. So guess what? All month long, you've heard that a big announcement is coming to WVON. You've heard it, I've said it, all the other personalities, you've heard the commercials, all of that. Well, please make sure you listen this coming Friday at 5 p.m. to the Cliff Kelly Show. Cliff will be sharing some big news. That's all I'm gonna say. He's gonna be sharing some big news. And then I gotta follow him after he shares big news. Oh no, I'm off on Friday. Thank you, little baby Jesus. There we go. All right. So we're back in studio with two of our favorite female doctors, Dr. C and Dr. G, and they are co-founders of Quench Wellness, located in the South Loop. And January is National Thyroid Awareness Month. So the doctors are here tonight to talk about your thyroid. So before we went to break, we figured out that your big toe being swollen ain't got nothing to do with your thyroid. Got that clear, okay? Aunt Bessie, did you hear that? Nothing to do with that swole toe. I keep telling you that. Ladies, how do we start knowing something is wrong with our thyroid?
So that's a great question, and there's kind of two major ways that we think about it. It depends on whether the thyroid is overactive or if the thyroid is underactive. So if we start with overactive, think about your thyroid as your go hormone. So that's what helps you to have energy and to keep your body warm and to, you know, give you mental clarity and everything that you need to go and do the things that you need to do. So when the thyroid is overactive, you are going too much, and that is from the head all the way down to the toe. So from, for example, like in your brain or kind of your mood and your emotions, you could have tremors, you could be nervous, you could be irritable, you can be anxious, you can also have trouble sleeping. With your heart, you can have a racing heartbeat. It can be fast. You can have palpitations, right? You can feel like it's beating hard as well. If you think about something like your stomach, you know, it's going too. So you might not necessarily have diarrhea, but you'll be going to the bathroom more consistently, more often.
Well, look, a lot of y'all need to have your thyroid checked.
Yeah, absolutely.
Just trying to get here to work at VON every day. I go through all those things just trying to get here.
And then some of the other symptoms symptoms too that are important to note for overactive thyroid. Again, it's your go hormone, so you might be losing weight even though your appetite really hasn't changed or your exercise habits haven't changed. You will feel hot all the time, like overheated, because you're just going and going and going. So that's kind of when we hear those type of symptoms, we start thinking about overactive thyroid.
And then on the underactive side of things, that's kind of the opposite. You're slowing down, so everything slows down. So from your mind, you'll find yourself being depressed, forgetful, just a little bit sluggish. From your heart will beat slower than usual. Your nails will get brittle. Your skin will get dry. You'll start to get constipated. You'll have aches and pains. You can even have swelling. So that's signs of an underactive thyroid. And they're subtle.
Lord, you told me I got a bipolar thyroid.
You're both at the same time.
Told me that my thyroid is bipolar. God dog it. Okay, so but really, because I mean everything you ladies shared, I'm sure somebody's listening kind of like, well, wait a minute, I don't, but I do. So they would be in the category of me with a bipolar thyroid. Not that it has been medically diagnosed, but so what's our first step to come get help?
So, obviously the first step is being aware, right? So it's great for everyone who's listening and getting this information. Once you realize that you may have some of these signs and symptoms, then the next step is to go see your doctor. The only way that we can really assess the thyroid, other than looking, right, and maybe feeling if we feel any nodules or if we see it enlarged, is blood work. Okay, so when we get the blood work, then we have a better idea as to what is happening on your thyroid pathway in your body.
I have a couple of other recommendations too. In addition to the symptoms, there's other circumstances where maybe you want to get your thyroid checked. If your vitamin D is running low, it doesn't hurt for your doctor to throw in a thyroid test too, because that could be a sign of your thyroid acting up on you. Another sign that your thyroid is acting up, if you have high cholesterol, it's worthwhile to get your thyroid checked as well. And lastly, if you're going through kind of perimenopausal symptoms, like I alluded to earlier, you're going through hormone changes, check your thyroid too, because the last thing you want is to fix your hormone changes and your thyroid's still acting up.
Oh boy. Okay, ladies, let's go to the live line and take some calls from our listeners. We have Ziff on the live line. Good evening, Ziff. How are you? And welcome to the show. Thank you. Wait, you breaking up? You breaking up? Stand in the kitchen with your arm up. Yeah, Thank you, sir. Okay. Okay. All right. Thank you so very much. Okay, so let me clean that up since he didn't insult everybody and his mama. We know of somebody who does have a thyroid issue, and we obviously see that. And then he kind of talked about obesity as well too. So now, does the thyroid and obesity run hand in hand?
So the thyroid gland, as I mentioned earlier, is important for your metabolism. This is your metabolism hormone, right? So when your thyroid is underactive, you will gain weight. Even if you're eating right, you're exercising, you're doing everything possible, you will gain weight. On the other end of things, if your thyroid is overactive, you will start to lose weight without much effort. So there is a link there, definitely with obesity and gaining weight with your thyroid. And so it's worthwhile to check.
Very good. All right, that was great. I cleaned that up good. Okay, all right, here we go. Let's continue on the live line. Let's talk to Steve. Hey, Steve, how are you? Welcome to the show. So you've had 2 thyroid surgeries. Oh, wow. And how are you doing now? So that is a result of you having the thyroid surgery? Right. Okay. All right. Well, Steve, you stay safe out there. Be careful in those streets, okay? All right. All right, brother. Thank you, brother. All right. Steve is a loyal and faithful listener. So now, for people who have been through things like Brother Steve, will he ever regain his voice back, or do we not know? Is it kind of a catch-22?
There's a couple of things he alluded to. He talked about his goiter. He said he had his thyroid removed way back when. And way back then, we didn't have a lot of iodine. So goiters were really, really common. So I would imagine that's why he had the first thyroid surgery. And then he had a subsequent one after that. One of the things that can happen in the midst of doing the thyroid surgery is you have nerves that run through. And specifically kind of your facial nerve and nerves that go to your voice box. And so sometimes it's very difficult when you're dealing with swelling like a goiter to see all the nerves, and some of them can be cut through. And you can have issues with your voice box as a result afterwards.
Okay.
So unfortunately, I don't think his voice is going to come back because that nerve is probably cut all the way through.
Got you. Okay. All right. Anything you want to add to that, doctor? Okay. Very good.
Got
Let's
it.
continue on the live line and talk to Jerry. Hi, Jerry. Thanks for holding and welcome to the show. Pleasure. Hello.
Hello. No, that's
Mm. Okay. All right. Okay, they get ready to tell you.
Yeah, I mean that's something that we see with a lot of patients, because the TSH is that first kind of screening blood test, but it actually doesn't always tell you what's going on with the thyroid. It's actually telling you a little bit more about what's going on with the brain thyroid axis. So it's excellent that you were an advocate for yourself and went ahead and sought further testing. We are very blessed to be able to offer not only hormone optimization with our estrogen and testosterone at Quench, but also with thyroid too. And so we know how important of a hormone it is and how, much of a role it plays in your entire health. And so, you're always welcome to come to Quench, and we would be able to test your thyroid for you, all your thyroid functions. Sure. So our phone number is 773-974-9481. And you can also always check us out online at quenchwellness.com. And we're on Facebook and all of that too.
People always say, give that number one more time.
Sure. That's 773-974-9481.
All
You're
right.
so
Have a great
welcome.
night. Be safe and be well. Okay. Thank you. All right. Bye-bye. There we go. That's how we help people. Really. I mean, just amazing. One would not know. What is kind of maybe the weirdest situation that you've ever heard was a thyroid situation? You know what I'm saying? Because really now you got me just sitting here wondering, like, Lord, my thyroid, bipolar, all that. 'Cause I really, but what are some of the weirdest kind of situations with the thyroid?
I'm sure we both have stories.
Yeah, I mean, I was going to mention goiter, to be honest, because it's pretty startling when you first see it, especially with with our generation, we didn't see it that often.
Right.
So, when I was in medical school, I was working at county, and so we saw a lot of patients from
yes, you
all over
do.
the
Yes,
world,
you do. Yes, you
and so you see a lot of the diseases that we don't necessarily see all the time. And I remember
Right.
when I saw my first goiter, I mean, just like your caller has said, it's like a football
Right.
sitting in your neck. So that's
Right.
pretty startling. I still
Yeah.
remember seeing that.
Yeah.
I had a patient that came in with heart failure. And so I thought it was straightforward heart failure. I mean, his legs were swollen. He couldn't breathe, so I thought that's what it was. We started down that pathway. And something said, check this man's thyroid. The textbooks always tell you that's one of the tests you should do out of the million.
Right.
But something said, check it. This man was in thyroid storm. His thyroid was so overactive, it was pushing him into heart failure.
Really?
Yes, his heart was pumping so fast. Yes, so
Wow.
fast that it pushed him into heart failure. So, it doesn't hurt to ask. And, one thing that was great about your last caller and how she advocated for herself, a lot of people don't know that there's different tests to check for with your thyroid. Yes, you have your TSH that you could check, but the thyroid actually releases two hormones, your T4 and your T3. And your T4 is commonly the one that most doctors check for, but you got to take it a step further. You got to check the T3 because that's actually the active hormone. That's the one that's actually doing all the work. And that's how she identified her low thyroid situation, was taking that step further.
Okay, very good. All right, when we come back from break, ladies, maybe we'll talk about how people can safeguard themselves against this weather that we're getting ready to have. Because this is getting ready to be a MESS.
Yes.
A mess.
Yes,
Right.
yes, yes.
A MESS, a mess. It is. It's going to be a hot mess. Well, no, a freezing
mess,
freezing
yes.
mess. I digress. A freezing mess. You're listening to the Monday night edition of Real Talk, Real People, where we're trying to just get your thyroid in check since you can't get nothing else in check. We'll be back in just a moment.
You a mess.
My great grandmother.
AMESS.
My great grandmother had a goiter.
Really?
And
Yeah.
That was
we
an old
went
school
down
back in
south
the-
to
right.
visit, and I go, Mom, what was that big old thing on her
Right,
head?
right.
And she fell behind the piano or something, I remember. And I was like, Mom, that wasn't normal. Didn't anybody ever notice that she had this big old thing on her neck?
Right.
No one ever talks about that, so I don't know if she ever had it looked at or anything, but I was like, Mom. And then I don't know how I knew it was a goiter later, because she died well before I went to college, and I was like, I think she had a goiter, Mom. My mother, I think you might be right.
But back in the day, folks just never even
No.
talked about that. You're right.
If
I
it
mean,
didn't bother
she
you,
was a
it
slender
just-
woman, and this huge thing in her neck. I'm like, dude, everybody else has to see what I see.
Right. No, that's just like I had a relative who, her doctors recommended that she talk to everybody who has ever been diagnosed with cancer in the family, so that her doctors would understand. And you'd be surprised. You call down south, and some people they can't tell you. So-and-so
They don't
got
know
a
what they
fever.
had exactly.
Yeah.
What is
It
that?
still happens to this day,
Yeah.
though. That's
It
crazy.
does.
Girl, what is
It
female
does.
disease? And like,
Yeah.
right? They don't know.
No, this generation, we are like, my uncle has prostate cancer, and they were like, well, what? What? I'm like, yeah, you gotta talk about things. You can't not talk about things.
Absolutely.
So that you
they're
can protect the
saying
next
millennials
generation.
Don't go to the doctor.
Yeah.
The millennials, why?
I think there's a few reasons. A lot of millennials aren't working, and so they may not have insurance, right? It's
a
very
big one.
different than their parents' generation, where you went to college, you got a job, you got your 401k, you got your health insurance, and
So we need to do this conversation one night and maybe even add you to it. Just just kind of the difference between our parents doing things and how we kind of, you know what I'm saying? That would be a great conversation.
Yeah, for sure.
absolutely,
Right.
absolutely.
And I think a lot of millennials, they just think that they're invincible. Yeah. It's like, dude,
I'm just looking at it. Look, I lost 5 people last week before last.
What?
Oh, honey, that's one reason why I had to get out of town. I lost 5 people.
In your family?
Just period. Just people I grew up
Oh
with.
wow.
And we talking about to the point that I was just like, I'm done. Yeah.
Whoa.
Oh yeah. Like I didn't even go to anybody's funeral on Saturday
That's
because I just couldn't.
Because it was just
I
too
That's
much.
many.
I just couldn't. Once it started snowballing, I was like, you know what? Never mind.
They say it comes in threes. That's
A lot.
I had 3 a week ago.
Hey y'all, we're on commercial break. Check us out on WVON.
She has her radio voice on, y'all.
I love it.
Because she doesn't sound like that when I call her. Hello, we're on commercial break.
She's auditioning. She was Indian. She needed to
53 after the hour, right here on the Talk of Chicago, 1690 AM, WVON. You're listening to Real Talk, Real People. I'm your host, Chat Daddy. It's the Monday night edition of your favorite entertainment magazine show here at VON, where we talk about just a little bit of this and a whole lot of that. You know it's happy hour, right? Yep, you should have that beverage of choice. We do not care what it is. We just want you to relax, sit back. Don't forget, we're expecting a polar vortex. I don't know what that is. I think I went to grade school with polar vortex. I do. I'm trying to check. Somebody get my yearbook. But I think I went to school with a chick named Polar Vortex. And she was a trip then. And so it's supposed to be really cold. It really is. So you guys just brace yourselves. For those of you that had put out those Cuddle Buddy applications, a lot of you all need to open up your waiting list. You may not like them, but then, ain't nobody gonna come to your house and clown. You know what I'm saying? When it's this cold, don't nobody want to be put out. So if you've been putting them Cuddle Buddy applications out there, you may want to look at them again. Open up your wait list. Because the next 3 nights, you're gonna want something to keep you warm. All right? I have Dr. C and Dr. G here in studio with me. These beautiful ladies are from Quench Wellness. These are 2 noted physicians here in the Chicagoland area. And we are talking about the fact that January is National Thyroid Awareness Month. And we've just had a wonderful conversation about thyroid disease. Now, ladies, with this brutal cold that is coming, what advice would you want to give to these people to help protect themselves?
Yeah, I mean, outside of trying to keep yourself warm, I think of most importance, you want to keep your immune system up. And a lot of that is going to have to do with what you're consuming and what you're putting in your body. So you want to really beef up on your vitamin C, also increase your zinc, making sure that you're sleeping as much as possible and keeping your stress extremely low during this time period so that you can fight any illnesses. As you know, last year we had a really horrible bout of flu. And we're really hoping that we don't have that this year. I mean, fortunately, in the hospital where I am, we haven't seen too many cases. So I really just encourage everyone to just keep their immune system up with those pearls I just gave you.
Mm-hmm. I'm drinking turmeric tea as we speak.
Nice.
Yes, good.
Excellent.
Absolutely.
As you may or may not know, I'm an ER doctor, so I see a lot of emergencies come through with people trying to warm themselves. So please be careful in terms of things like turning your oven on to heat, leaving that open. That can expose you to dangerous fumes. Be careful of what you're plugging into your electric outlets. Try not to plug too many things in that can start a fire. So if you really need it, you can always go to like an ER or warming centers throughout the city. But please be very careful trying to warm yourself at home.
Very good. All right, so you guys have heard it straight from the doctors. No warming yourself at home. Mess around like me today. I was sitting in the dark. I had too many things plugged up. And so I had to go and reboot everything. So definitely no open flames, no leaving that stove burning and opening all night. Also, make sure you don't overload your electrical outlets. Things, some things need to be plugged directly into the wall. Other things can be plugged into an outlet. I'm one of those people, don't go to sleep with all that stuff on anyway.
Exactly.
Yeah, just don't go to sleep.
True.
Turn it off after, put
Absolutely.
it on a timer or something like that.
I mean, you sleep better when you're cold anyway, so.
Is that the case? Is that what it is? I start off warm, and then I told you I had an electric blanket. I only turned it on one side of the bed, and then after a while, I had to get under the cold side.
Exactly.
Oh, that makes good sense. I was worried about shrinkage. See there? All right, there you go. All right, so that's how that works. Doctors, how can we follow you, ladies? Find you, all that great stuff.
So you can find us across all social media streams. Just search for Quench Wellness South Loop. We are located at 1319 South Michigan Avenue in Chicago, South Loop. Our phone number, again, is 773-974-9481. And visit our website at quenchwellness.com. Take a wellness assessment. It's completely free, and we can get you started on your wellness journey. We would love to join you.
to rehydrate that body.
Exactly.
Yes, because that's so important. What else, Doctor? Dr. C, what would you like for us to know?
You know, I just want you guys to take a step every single day towards your health. Be an advocate on your own behalf. And at Quench Wellness, we're all about that. So we have you covered from the IV vitamin infusions, hormone optimizations, to the vaginal revitalization. Check us up. We're here to be there for you.
Mm-hmm. I've had everything but that vaginal revitalization. Something about that. You guys were here the last time.
Yeah.
I don't think you
I know.
qualify.
That's kind of like that, girder in the toe thing. Yeah, that's right. Well, I just want to be a well-rounded host. You know what I'm saying? One day I say, yeah, I had that product and service done too. Did not happen. Well, ladies, I love you both so very much. Thank you for coming out and hanging out with us this evening. Give us the number and website again, please.
Sure. You can find us at www.quenchwellness.com. Our phone number is 773-974-9481.
Beautiful. I love you both. Thank you so very much. And I
Thank
look forward
you.
to our next segment.
Thank
Absolutely.
you.
All right, when we
Stay
come
warm.
back, thank you. When we come back at the top of the hour, Dr. Rita J. McGuire is here, a wonderful doctor, and she's going to be here to talk to us about alternative medicine, health, fitness, you name it. The entire rest of the show, she's going to answer